Case management entails a number of different things. So one of the things that happens once we place a patient in treatment is that we have the ability to liaison with the family. The way that we do that is we take weekly or regular calls, sometimes bi-weekly, sometimes daily calls with the treatment center. That includes the therapist, sometimes it includes the medical director, it may include even ownership in certain instances. And one of the benefits to the family is we can help problem solve as the patient goes through different stages of treatment. Seldom do patients just get to treatment, especially the ones that we tend to get, high acuity cases, very complex cases, and everything just goes smoothly. One of the things that we do for families is help problem solve along the way, making sure that their loved one's getting good care, making sure the facility has everything they need from the family, and also making sure that it's a good fit for that particular facility, patient, and family. If it isn't, we can certainly create options that make sense for the center, for the family, and for the patient, keeping all of the communication transparent within all parties. In this way, we serve to keep the patient in treatment for the length of time indicated by the particular condition and improve the likelihood of more positive outcomes.
If somebody's in a facility for a month or 2 months and they're ready to take the next step to a different level of care, if maybe the family decides a different facility would be the best option, we can help make that transition smooth and just continue to work with the family and give them their outside support that they need.
The reason that ongoing case management is important after a loved one goes into treatment is because the intervention and the treatment piece is just but one segment of the episode of care that their loved one is going to experience. A lot of times families will think that once their loved one gets into treatment, there's no more work to be done. But what we find is that when an identified patient enters treatment, and even leading in the days, months, and years leading up to the event, there's an entire family dynamic system. Envision this like a human cell. And anytime something shifts inside that cell, the cell no longer has homeostasis. The family doesn't have homeostasis even once the loved one goes into treatment. Though the patient and the family get relief, there's more work to be done on the outside. So oftentimes what we do is liaison between the family and the facility, sometimes between the families and attorneys or some of the legal system components. But the other piece that's really important is getting the families connected to their own outside clinical services. So case management is just about continuing to do the work and also helping manage expectations for the families as to what they can expect, both from the trajectory of treatment, the sort of prognosis of the patient based on what the treatment center is giving us. So there's a lot that goes into case management after we are done with the original intervention or once the loved one enters treatment. And so that's why we believe that case management is so important for families.
We offer them family coaching, support. Issues always seem to come up with their loved one in a facility. Nobody wants to go to treatment. So the patient's going to find some reason to complain. We act as the buffer in between, with the facility where we can get updates, which we do update the family with. And we also have information that can calm the family down so they're not calling the facility and they're allowing the facility to do their job. So if the loved one is now off getting the help that they need and nothing changes on the family side, when the loved one comes home, they're going to go right back to how they were before. So because this is a family disease, the whole family has to have some type of treatment. So not only do we offer support, but we do refer them to therapists or psychiatrists if they need to, so they can get their own outside help while their loved one is getting treatment on the inside.